refugee migrant crisis in former Yugoslav Republic of Macedonia. And actually we tried to make an overview of the whole situation, because actually comparing with Greece and Serbia, we are accounting ourselves as a transit country for quite a long time from during this crisis. Actually, it was 2015 when it was first starting to be announced through the media related to the Balkan route, related to the refugees coming from Iraq, Afghanistan, Syria, and other countries, trying to pass through Greece, Macedonia, and Serbia, reach Croatia and Hungary, and trying to go to the final point of one of the Western European countries. This is, there were first announcement of the small group of people coming near the border and passing very quickly through the country during 24 hours. There were some estimation that they tried to pass Macedonia on foot during 24 hours. And actually, they were following the railway track, most of them. In such a short period of time, it has been really a lot announcement of accidents, railway accidents, because they suffered trying to sleep close to the railway track or just going through the railway track. After that, it's happened that they started to cross Macedonia by bicycles, and actually it was possible for them to buy not really expensive bicycle. Of course, you're supposing that the prices of bicycles started to raise. And actually they were trying to pass also by bicycle or illegally with the taxi drivers who were asking them for quite a high amount of money to be paid to pass Macedonia. Actually, one of the biggest railway accidents actually was like 14 people died in one moment related to the passing the railway track. Afterwards, it was the beginning, even from the beginning, it was like small groups. In one moment, there was a flow of a huge number of refugees, which actually started to be a very big burden for the whole country. And the people started to scared, and it was, and we estimated around, which is quite close to the numbers which has been already said from our colleague from Greece and actually from Serbia, more than 800,000 people pass former Yugoslav Republic of Macedonia during 2015. These are the trains which has been organized actually by the government. And they were free of charge for them to be transferred from the border of Greece to the border of Serbia. Actually, related to the official data, none of the refugees were really interested to stay in Macedonia. We are not such a bad country, but actually the intention was to go to Western European countries. The organization started, and actually it was a very big support coming by actually the European Commission, which gave around 4.4 million euros, and we started to organize a transit center with the support of UNHCR. And afterwards, the whole organization of staying in the transit center has been established. And now Vladimir will continue. We are shared the responsibilities of your questions later on. That's why we are both.
Thank you, Vesna, for setting up the scene. As you see, at first, Macedonia, we thought that we will remain in this situation during the crisis, and we will remain as a transit country. but things change. So, but in the meantime, we started to organize the transit centers. As the influx growed and grow, we had to set up some also healthcare facilities within these registration points, because there were mostly that registration points, 1-2 day stay, and then the refugee would leave the country and continue their journey. In order to provide the health services and surveillance of any possible outbreaks, we established epidemiological teams within the centers who would visit daily there. And also we had a medical team, both medical doctors and nurses who were present 24 hours per day at these registration or transit points. And also we had a huge help of the international community, mostly Red Cross, UNHCR and others who were there. We had coordination meetings every day when they reported the cases. We did not still develop any syndromic surveillance, but we relied on point of care registration. We provide some medical screening and triage for the urgent cases, and we set a sentinel hospital in both South and North Point for urgent cases that needed medical attention. Of course, we checked for the vaccination status as well, and we at that time offered possibility for vaccination for the refugees. However, the scenario changed and caught us a little bit off guard, let's say, but we were so in 2016, after the closure of the border, almost 1,100 refugees remained strained in the country in the two centers, North Tabanovce and South Vinojuk. So we had to come up with another plan, yes, and to make this condition much better, because these were primarily shelter centers with tents, but the living conditions were not suitable for longer stay. So these centers, with the help of international community, growed up from transit to more, let's say, permanent in quotes, because, as Professor Vesna said, none of the refugees applied for asylum. So we did not have asylum seekers. So their intention was to leave the country and continue the journey. We did up at, there was an intersectorial meeting when we made up an ad hoc action plan with 4 main focus, and that was related to transit refugees, the permanent, okay, my apologies, and those who will eventually apply for asylum, need for medical intervention, and need for hospitalization, like prioritizing. So I will not go into details with surveillance data, because as you said, we had only 1,100 refugees trained in the centers, but the main goal was also to actually calm the population, that they do not pose any threats in regard to the communicable diseases, and we all well know that that is the case, and it was already proved by Professor Takis and every other. But this is just a snapshot from the surveillance data. So the system was organized as a regular surveillance system. So we had a case-based surveillance, because we did not have a huge number of cases which were under surveillance. And from the roughly 3 months period I'm presenting here from the transit center in the north, Tabanovce, as you can see, we have just very few cases of mostly watery diarrhea or enterocolitis, skin infections, concretely scabies, and some cases of varicella, which is nothing unexpected. And we did had a small outbreak, one small outbreak with food poisoning, which was detected in week 12. Again, nothing out of ordinary or nothing out of the baseline that was in the general population. And the age distribution also showed that the youngest population is most at risk, just to identify any risk group. Also, during their stay in the camp, now we had to provide vaccination as well. And the main concern was polio, so we did one vaccination campaign in 3 days in the week of April, when we vaccinated close to 700 people. Most of them were children, but we did also vaccinated also older adults above 18 years. So, because almost none of them had their medical records with them. So we, by the protocol, if they don't have the proof of vaccination, we did have to vaccinate. So thank you, and if you have any questions, we were glad to accept it.
Is there any questions for Vladimir or Vesna? No? Ah.
Thanks. This is a question I've been wanting to ask actually for some time, so it's not just for you, but it's been inspired by the video that you showed at the end. So I'm aware, obviously, whenever any kind of camp is set up, that epidemiologists come in and we set things up for infectious diseases and for malnutrition and that kind of thing. But is there any kind of input from child safeguarding, child protection specialists in the way that those camps are designed to kind of reduce children being at risk of, trafficking, sexual violence, that kind of thing? I was just wondering if there is any kind of emergency response where child safeguarding professionals are involved.
Actually, the activities related to the children has been organized through UNICEF, as well as the local NGOs and social workers from the NGO, which are the volunteers in the NGOs, were also involved in the activities related to the children. And actually that's why we pointed out, it is one side of that is just to be aware and protect the possible violence against children. Even most of the children who have been actually as permanently stayed in the camps were already with their parents, usually mother, and the father has been already, he has already left in some of the Western European countries. And also there were social workers and psychiatrists working with these children. That's why Vladimir pointed out just to see how they're seeing their the migration, all this traveling, how they're seeing these boats and everything. Probably it was the main thing which was putting the memories forever related to this route.
Any other questions?
Thank you for your presentation. Just a quick question. During the big transit phase of the crisis, who were the health providers in the transit camps and later on in the more permanent sites?
So during the transit phase, we had the local health authorities being present in the field. So we had so-called centers like health houses or primary health units. They had their team. We had a mobile unit as well there, and also Red Cross was present all the time. And we had the hospitals that were appointed to and had all the time teams ready to accept any cases needing hospitalization.
So that was more or like scenario one yesterday in the surveillance exercise. Well, the health provider was the national health system, and there was very limited presence of health NGOs.
Yes.
Great, thank you.
At the beginning, it was like that.
Yes, thank you.
And we also have a few delivery of the babies, and also there were a number of cases, but not a huge one, of needed emergency intervention, and these people have been transferred to the hospitals, and interventions has been provided.
Thank you. Last question from Anna.
Yes, thank you so much. Since we are talking also about access to healthcare and so on, how do you consider the access of asylum seekers, refugees, and undocumented migrants in Macedonia? And if it's going to change from now on, since maybe these people will stay or not, if possible. Thank you.
Current number of refugees staying in Macedonia is quite low. We have 45 cases more than for a prolonged period of time in the transit centers. They did not still apply for asylum. so that they want to continue. So it's a little bit, awkward situation. But we had the experience before with the Kosovo crisis. We had a huge influx of refugees and quite a high number of people who actually applied for asylum and stayed, mostly from Roma nationality. And somehow we managed to, and we have a special law for that, and we managed to incorporate them in the original system, regular system for healthcare. But it's not that easy and that smooth,
120,000 Roma refugees from Kosovo to Macedonia, and they stayed all this period of time. They are already integrated in the system.
Thank you very much to both Vladimir and Bess.